two cases are seemingly unrelated to each other, no travel history. What does that say about community spread with this strain, and how widespread do we think that this strain is in our communities here in South Carolina at this point?
So I think that at this point in time, we have very limited information to go off of, with two cases having been identified. Keeping in mind that we have been doing sequencing already previous to this, and these are the first ones we have identified. And so while there is no known travel history with these, we also are doing deeper dives into other history that they might have had, or exposures. I think that it is really too early with two cases to make predictions based off of that.
We'll try and go back to Zach real quick. Zach, can you ask your question, please?
Yes, can you hear me?
Yes.
Sorry about that. So yeah, I was wondering if there's any data that's been found in other parts of the world that have the South African variant already, how quickly, because it's more transmissible, how quickly it might start to become a more common strain in South Carolina, even though it currently obviously is not.
Sure, and so I think that there are some preliminary studies and modeling that suggest that some of these different variants, the United Kingdom, the South African one, et cetera, could be 50 to 60% faster spreading, but there is still data that is being collected, because while it has been in numerous other countries, certainly before the United States, the identification, at least of these new variants, has still been fairly recent, and so they are still having to collect data and do analyses to look more closely at that.
Anne?
Hi, Dr. Traxler. Thanks for taking the time today. Do we have any idea from contact tracing how many others these two cases have been in contact with?
We do not have concern at this time based on their contact tracing about there being the potential for any mass widespread transmission.
Caitlin?
Hey, I wanted to ask, can you go through a little bit about this sequencing process and how many COVID tests are being sampled for this variant at this time? And I'm asking this because I saw a story last night out of Augusta, and they were talking about how, just picking up a couple of these cases in South Carolina could realistically mean that this is already spread and there's possibly, 200 people or so that have it at this point. It just hasn't been discovered. Can you speak towards that at all?
Certainly, and again, I think that it is very early based off of two cases to be able to say for certain. We can get you the numbers for how many specimens we are sending to the CDC, as well as how many we are sequencing in our laboratory. I also do want to point out too, though, that there are numerous other labs that are doing sequencing, including many of the large, national laboratories that many specimens from South Carolina get sent to. So the numbers we have would not be representative of the entire amount of sequencing that's going on, but we can get those for you.
Richard? Richard, do you have a question? Can you unmute, please?
Yes, I do. Yes. Thank you very much. I appreciate it. And I had to switch computers right fast, so I apologize if this is a redundant question. But how were these cases detected? Was this voluntary testing, and were either asymptomatic?
Again, we're not going to give any more specific details about these cases, but I will say that both were picked up during routine surveillance sequencing.
Vanessa?
Hi. You mentioned that their contagious period has passed. Are you able to give us a better idea of when that contagious window was?
Yes, it would have been earlier this month.
Judy?
Yeah, I just have a quick follow-up question about the booster. Can you give us any idea, Dr. Traxler, of and I know this is, a novel virus and so a new process, but typically as vaccines go, how long does it take to develop a booster for those who would be interested in getting it? What kind of timetable are we looking at, and what does that involve? I mean, is that just another shot of another dose, or is that something different from what they've already received?
So certainly, and that is where this is a big benefit, the type of vaccines that the Pfizer and Moderna ones are. Being the mRNA vaccines, they can be adapted, basically edited to be effective against a new variant in a much faster manner than your typical vaccine platform. It literally, for them, will be a matter of plugging in some different of the mRNA code that's been, mutated, the mutated one. But I think what remains to be seen is would be then after the development, which should be fairly quickly, whether production is going to begin. And I suspect much of this will be driven by how much of the variant and each one we're seeing in the United States. But it would be a matter then of looking at production and such. And I would imagine that at this point it would be if somebody has been vaccinated with the two-dose regimen already, that it would likely be a one-shot booster. But we'd have to find that out for certain from Moderna.
Sam?
Hey, Dr. Traxler. You mentioned private lab sequencing. Has DHEC requested private labs it contracts with the sequence samples, or is that something they do on their own? Can you maybe walk us through that?
So I would say that it is some of both, depending on just the size of the laboratory and the relationship that DHEC has with them.
Joel?
Dr. Traxler, can you tell us what the dates were for when these two people were tested? And I know you don't want to give details about the cases, but have they recovered from their infections?
So both were tested very early in the month. And my understanding is that